How's it going? I'm Dr. Jaillet.
Nice to meet you.
What's your name?
Lucas.
Lucas, nice to meet you, Lucas. I'm going to be evaluating your spine. It's going to run from the back of your head all the way down to the back of your butt loop. I need to further expose an area for further evaluation. Is that okay with you?
Mm-hmm.
Alrighty. Alright, would you mind taking your shirt off real quick and face the wall, please? May I grab the front of your head, please?
Mm-hmm.
Relax in here. Alright, first thing I was assessing, I was doing a general scan, and I was performing a general scan on the pelvis.
Alright, tell us, David, what was the contact point?
My contact point, I was using my thenar eminence, and I was on the medial aspect of the PSIS.
Alright, what about the line of drive?
I was pushing P to A, medial to lateral, at a 45-degree angle.
Alright, thank you.
After assessing the pelvis, I moved on to assess the lumbar and thoracic spine.
Alright, and what was the contact point?
My contact point was I made a loosely held fist, and I was contacting the midline of the spine with the spinous processes.
And what was the line of drive?
I was pushing P to A, following the curvature of the spine. After assessing the lumbar and thoracic region of the spine, I moved up to assess the cervical spine.
And what was your contact point?
My contact point was the articular pillars of C2 through C7.
And what was your line of drive?
My line of drive was pushing P to A. I started at the lower part of the cervical spine, S to I, and then moved slowly up to I to S direction. Alright, Lucas, can I get you lay face down on the table, please? When I took a further assessment on the pelvis, I went to check the ilium first.
And what was your contact point?
My contact point on the ilium was the SI joints.
And what was the line of drive?
My line of drive, when I was assessing anterior glide, I was pulling up on the same side I was assessing the ASIS, and I was feeling for anterior glide. And then for posterior glide, I was still at the SI joint, and then I lifted the patient's knee up, and I was assessing posterior glide. And then I further assessed the medial and lateral glide aspect of the ilium by rotating the foot medially and laterally. May I roll up your bridges if you don't mind?
Yeah.
After checking the ilium, I went to further evaluate the sacrum when I was assessing the right oblique axis.
And what was your contact point?
Well, first, when I was assessing the right oblique axis, I was in a fencer stance, making sure I was looking down that right oblique axis. And my contact points were at the left sacral base and then at the right sacral apex.
And what was your line of drive?
My line of drive was always pushing P to A. After assessing the right oblique axis on the sacrum, I switched my fencer stance into a perpendicular with the spine, and then I was assessing the transverse.
And what was your contact point?
My contact point was medial base, and then the sacral hiatus.
And what was your line of drive?
My line of drive was P to A. After assessing the transverse plane of the sacrum, I went to the left oblique axis, so I switched my fencer stance. I was looking down the left oblique axis.
And what was the contact point?
Contact point, I was on the right side, sacral apex, and then the left sacral base, pushing P to A.
And what is the line of drive?
I was pushing P to A. After assessing the sacrum and everything was checked out, I moved on to the L5S1 interspinous space.
And what was the contact point?
My contact point was both the left and right interspinous space of the L5S1.
And what was the line of drive?
To check for the abduction of the L5S1 to feel closure in the joint. I brought the leg, the side I was checking, I brought that leg, I abducted it out. And then for rotation, I grabbed the opposite ASIS, looking for rotation. All right, we cross your arms, please. And bend down. Would you cross your hands over your arm, flex forward for me? Or bend forward, please. Would you bend forward again? I noted on my general scan a little bit of floor-like feeling when I was in the T8, T9 region, so I went to further evaluate that area.
And what was your contact point and the line of drive?
My contact point, I located my if in between the T8 and T9 spinous process, and I flexed the patient forward and extended them backward, feeling for opening and closing between the spinous processes. And then for rotation, I rotated the patient towards me on the side I was checking, and then I was feeling for resiliency, and everything checked out. And then when I went to lateral bending, I laterally bent the patient towards the side I was assessing, and then looked for resiliency again in that. All right, Lucas, stand up now, please. And if you could, for me, bring your head down to your chest, and then your head all the way back, closing your eyes while you do this. And whenever you feel comfortable, just keep your head in a neutral position. I'm going to note that it's slightly inferior. Could you have a seat facing the windows, please? Alright, I'm going to slide right inferior to the mastoid process. Take a wide contact grip. I'll be on the lateral aspect of the atlas. Be checking translation. And be moving lateral to medial. Pushing on the right side and left side. Looking for rotation, and it all feels good. Next, I'm going to slide back to the posterior arch of the atlas. Rotate his head to the left. Now to the right. All feels good. Alright, thanks.